So today we are going to talk about the link between occupational stress and oral health issues. So everyone experiences stress sometime in their life, and some are better at coping with it than others. Stress can result from an event, family, friends, an illness, everyday life, or work, which is what we'll be talking about today. Sudden spikes in stress, including chronic stress, can cause various oral health issues. Many people tend to get so stressed that they disregard their own oral health, and their minds are focused on so many other things, and their own oral care is basically put on the back burner. So later on in this lesson, we'll learn about ways to manage stress in life and in the workplace. So, a few stress and oral health concerns we'll be discussing are periodontal disease, dry mouth, also known as xerostomia, and TMJ disorders. Next, we are going to discuss periodontal disease. First of all, what is periodontal disease? Well, it is characterized by chronic inflammation of the gingiva caused by infection with anaerobic bacteria. And anaerobic means that the bacteria does not need oxygen to survive. And this disease can result in loss of bone, mobility, tooth loss, inadequate nutritional intake due to not having all your teeth, and it's difficult to chew. So those are a few results of periodontal disease. It can also put a person at a higher risk for certain chronic conditions such as cardiovascular disease and diabetes. So there was a study from the Journal of International Oral Health that said the prevalence of periodontitis among those who were stressed was around 71%. And the odds of having periodontitis among those who reported job stress was 7.5 times higher than those who did not report any job stress. So that's a pretty big number. These people probably develop periodontal disease because they forget to brush and floss. So those are two main factors as to why periodontal disease affects these people. Next, we're going to discuss dry mouth, also known as xerostomia, and the link it has with stress. So saliva is an extremely essential part of the oral cavity. It lubricates the mouth, aids in digestion, and can help prevent caries and bad breath. So stress, it can actually alter the state of a person's saliva. Protein in the saliva increases, which causes it to become slimy. And this can lead to bad breath and ultimately lead to an increased risk of caries. So people who develop caries that work in stressful environments tend to leave them untreated. Why do people leave caries untreated? Well, in a study from the Journal of Occupational Health, it was determined that caries were not treated because 54% had no pain, 32% did not think it was a problem, and 31% were too busy with work. So clearly people don't, when they have a very demanding job, they're not thinking about these things. The dentist is the last thing on their mind, so they may not have the time to go to the dentist pretty much. So leaving this issue untreated can result in pain, which can ultimately raise their stress level because now they're busy with work and now they're in pain. So this is why it's so crucial to prioritize your oral health. So next, we're going to talk about temporomandibular joint disorder, also known as TMD. This is one of the most common conditions among patients. So many people suffer from it. It's caused by stress a lot of the time, and it causes a person to clench during the day or grind their teeth at night while they're sleeping. There was a study done from the Journal of Industrial Health, and it stated that previous research revealed a variety of work-related oral health problems. And so these included associations between a declining work performance by an employee and TMJ-related pain, along with frequent bruxism and working stress. So this constant force that you're putting on your jaw can ultimately result in TMD and can be quite painful at times. So when a person feels like they are not excelling at their job or they're not doing a great job, then this can trigger stress and cause them to grind or clench. And it can also raise their stress levels. So constant clenching and grinding can lead to erosion of the teeth, such as abfraction and attrition. And these conditions can cause exposure of the nerve, which can cause a lot of sensitivity. So there are ways to relieve stress. One is a night guard. Now this will protect the teeth from grinding against one another and prevent further wear of the teeth. And it'll also put a little less stress on the jaw. Another way is stress reduction, which we are going to talk about next. So next we're going to talk about how stress can be reduced in healthcare workers. Healthcare workers are known to endure immense amount of stress due to hectic and demanding schedules, and many people are unaware of the ways that stress can be reduced. So there's a few steps that can reduce stress in the workplace or just overall stress in a person. So these can be really helpful, especially when you deal with a lot of stress in your workplace. So step one, you want to identify potential work-related hazards. So you want to gather information from coworkers about what triggers their stress and report work-related stress hazards to your employer and the health and safety representative. And you want to encourage colleagues to do the same. Well, the second step is to assess work-related stress risks. You want to indicate when, how often, and over what period of time stress-related work risks occur. And you want to explain how work-related stress can affect or harm your health. So the third step is to control the work-related stress hazards and risks by contributing ideas on ways to control stress hazards and risks in the workplace. So the fourth and last step is to implement continuous improvement. So you want to report the effectiveness of all those other steps I just talked about to the management and the health safety rep to make sure that it's working correctly and ways that it can be improved. So you also want to contribute ideas on how to improve its effectiveness if it's not working to its full potential. And you want to report any new risks of stress that may arise, because you want the least amount of stress in the workplace just to make your day more enjoyable. We're going to talk about other stress reduction tactics that you can try in the workplace or just every day. You can limit your work hours to no more than 12 hours a day. You can rotate work from high stress to low stress. You can use counseling, which is sometimes provided by your employer. Drink plenty of water and consume healthy snacks. You can also take frequent but brief breaks. If you feel like you really need a break, just take one. You can talk about how you're feeling to a colleague or your boss or just anyone. Stay in touch with family and friends. It's really important. Don't shut them out. And monitor each other's stress at the workplace. If you notice that someone is really stressed out, go up to them, talk to them, find out why, and try and resolve it. Hi! So today we are going to talk about the link between occupational stress and oral health issues. that's it for my presentation. I hope you enjoyed it and got a lot out of it, and thanks for watching.